Hey, healthcare warriors! So, have you ever cared for a pregnant patient who looked totally fine one day, then suddenly had really high blood pressure and swelling the next? That could actually be preeclampsia, a dangerous hypertensive disorder of pregnancy that can escalate pretty quickly and threaten both mom and baby. Let's break down the warning signs, nursing care, and why early detection could honestly be life-saving. Preeclampsia is a pregnancy-specific hypertensive disorder that typically develops after 20 weeks gestation. It's characterized by new-onset hypertension, so blood pressure at or above 140/90 millimeters of mercury plus proteinuria, which is at least 300 milligrams in 24 hours, or other signs of organ dysfunction, like elevated liver enzymes, low platelets, or renal impairment. If left untreated, it can progress to eclampsia, which means seizures, HELP syndrome, or even lead to placental abruption and fetal growth restriction. Let's talk about risk factors. First, pregnancy, age under 18 or over 35, history of chronic hypertension or kidney disease, obesity, multiple gestation like twins or more, and a personal or family history of preeclampsia all increase the risk. Now here are the signs and symptoms to really watch for. Blood pressure at or above 140/90 millimeters of mercury on 2 occasions, proteinuria or signs of end organ damage if that's absent, edema, especially facial or hand swelling, persistent headache, blurred vision, or photophobia, right upper quadrant or epigastric pain, hyperreflexia or clonus, sudden weight gain, and decreased fetal movement or abnormal fetal growth. So when it comes to diagnosis and monitoring, there are a few key steps we always take. First, we keep a close eye on blood pressure. We also check urine, either with a simple urinalysis or sometimes a 24-hour urine collection, to look for protein. Next, we run a complete blood count to monitor platelets. Liver enzymes and creatinine are checked as well, just to make sure the liver and kidneys are working properly. And finally, we use fetal ultrasound and non-stress testing to keep track of the baby's growth and overall well-being. Alright, let's talk about management and treatment. For mild preeclampsia, it's important to monitor blood pressure and labs, make sure the patient is getting enough rest, and keep up with fetal surveillance. If everything stays stable, delivery is usually planned at 37 weeks. Now, for severe preeclampsia, hospitalization is necessary. Antihypertensives like labetalol or hydralazine are used, and magnesium sulfate is given for seizure prophylaxis. If the pregnancy is less than 34 weeks, corticosteroids are given to help the baby's lungs mature. Ultimately, delivery is the only cure, and the timing really depends on both the mom's and baby's status. So what are the nursing priorities here? Well, first, you need to monitor blood pressure frequently. Keep an eye out for any worsening symptoms, like headaches, vision changes, or epigastric pain. Reflex checks are essential, and you also want to watch for signs of magnesium toxicity. Seizure precautions are a must. Think padded rails, suction setup, and creating a quiet environment. It's also really important to educate patients on warning signs and when to seek help. And of course, support their emotional well-being and help with birth planning. Here's the bottom line: catch it early, save 2 lives. Preeclampsia doesn't always come with loud alarms, but nurses are trained to spot those subtle signals. Your vigilance can truly mean the difference between a crisis and a healthy delivery. So, what's your #1 tip when caring for a preeclamptic patient? Drop it in the comments. And don't forget to like, subscribe, and follow for more maternal fetal care insights. Because protecting moms protects the next generation. And remember, monitor, manage, deliver safely.